Welcome to this video on meal timing and reflux care. Optimal physical health is not just about what we eat, but also when we eat. This video will cover circadian alignment and structured meal scheduling to help prevent acid reflux and support metabolic health. When it comes to meal frequency, aim for 3 main meals per day. Space these meals 3 to 4 hours apart to keep blood sugar stable. Importantly, finish your last meal 2 to 3 hours before bedtime to allow for proper digestion. Experts recommend 3 balanced meals daily, potentially adding a small, high-protein snack only if the gap between meals exceeds 5 hours. Avoid the myth that constant grazing is better. Studies show that consistent spacing is more effective for metabolic health. To support your digestion, close your eating window at least 2 to 3 hours before sleep. Aim to finish your day's intake within a 10 to 12-hour period, as your body processes glucose more efficiently in the morning than at night. Here is an example schedule. Breakfast within an hour of waking, lunch 4 to 5 hours later, a light snack if needed mid-afternoon, and dinner finished by 6:30 p.m. Consistency is key to maintaining stable energy levels. To optimize your digestion, follow these 3 core principles. Stick to 3 moderate meals, stop eating by 6 p.m., and maintain an upright position for 3 hours after your final meal before heading to bed. This tailored schedule provides a steady supply of nutrients for your brain and body, while ensuring your digestive tract has the necessary rest to prevent acid from traveling back up the esophagus. When structuring your plate, focus on lean proteins and complex, gentle fibers. Avoid known triggers like heavy spices, onions, tomatoes, and caffeine, and remember to stay upright for at least 30 to 60 minutes after eating. Nighttime reflux often occurs because lying flat removes the aid of gravity. Furthermore, during sleep, your body produces less protective saliva and swallows less frequently, meaning any acid in the esophagus lingers longer and causes more irritation. To mechanically prevent acid from rising while you sleep, elevate your head and upper torso by 6 to 8 inches. Do not just stack pillows, as this can compress your abdomen. Instead, use a foam wedge or bed risers. Anatomically, your stomach curves toward your left side. Sleeping strictly on your left side keeps the connection between your stomach and esophagus above the level of gastric acid, acting as a natural physical barrier against reflux. Your evening meal should be designed for rapid digestion. Eliminate saturated fats like heavy oils and fried foods, and avoid known triggers like mint, garlic, and citrus to keep your stomach comfortable overnight. If you wake up with reflux, take immediate action. Sit upright to let gravity pull acid down. Take small sips of lukewarm water, and consider chewing non-mint, sugar-free gum to increase saliva production and neutralize acid. Reflux hits harder at night because lying flat removes the pull of gravity, allowing acid to pool. Combined with reduced saliva production and less frequent swallowing during sleep, acid can cause significant irritation. Finally, remember that the most effective way to elevate your sleeping position is to raise the head of the bed or use a dedicated foam wedge. This provides the correct angle for consistent, stable reflux relief. Moving on to our next section, let's discuss why standard bedtime antacids often fail to stop morning cough. It comes down to how they work and what they actually address. Antacids primarily neutralize stomach acid for a short duration, typically 30 to 60 minutes. They do not mechanically stop the backwash of gastric enzymes that occurs throughout your 9-hour sleep window. A major culprit is pepsin. Even if antacids lower acid levels, pepsin can hitchhike on stomach vapors, deposit in your throat, and stay active, triggering a coughing loop when reactivated by morning acid exposure. To adjust your night routine, consider asking a professional about sodium alginate suspensions. These derive from seaweed and create a buoyant raft on top of your stomach contents to physically block reflux. Maintain your sleep angle by elevating your bed frame by 6 to 8 inches or using a firm foam wedge pillow. This ensures your throat remains higher than your stomach throughout the night. Start your morning by drinking lukewarm water. This simple step dilutes accumulated stomach acid and physically washes residual pepsin away from your vocal cords, helping to clear your airway. If you suffer from a persistent cough, consider consulting a specialist to rule out environmental factors or medications. Thank you for joining us to explore these steps toward better digestive health.